From the temporary to the permanent. A pencil leaves a temporary mark, but a pen leaves a permanent mark. This represents a temporary cough, whereas this is a permanent cough. Let's delve deeper and understand the difference between the two. Hi everybody, my name is Dr. Sanjay Arora and welcome to my YouTube channel where I help you unburden your health. So what is a persistent cough? A cough that lasts for more than 2 to 3 weeks without resolving is considered to be a persistent cough. Now, the commonest reasons are infections in our country. You could be having a chronic cough, sore throat, a runny nose. It could be chronic bronchitis. These are generally resolved within 2 to 3 weeks. But if they persist, we need to dig deeper. Tuberculosis is a very common infection in our country, so must be ruled out if your cough persists for more than 2 to 3 weeks. If infections are ruled out, smoking is the next biggest cause for a persistent cough. So if you're a smoker, please get yourself checked. But if smoking is not the cause, one of the biggest reasons today is medication for high blood pressure. The commonest drug that is used today is inhibitors. If you are taking an ACE inhibitor, you are likely to have a persistent cough and go back to your doctor who may change the treatment. If these causes have been ruled out, then you must look at the reason for allergy or hay fever or allergic rhinitis is a common cause for persistent cough. So you will have to get yourself tested for these conditions, and if these are ruled out, look for the next condition, which is gastroesophageal reflux disease or GERD. Many people, I too, have this problem where I have a persistent cough because of reflux, which causes acidity and gives irritation to my throat. If all these conditions are ruled out, you must look at asthma, especially if you have difficulty in breathing. So if asthma is another condition that should be considered if you have a persistent cough. One of the commonest reasons for a persistent cough is a postnasal drip. So especially if you're lying down and you start getting a cough, that could be one of the reasons. So get yourself checked for a postnasal drip to rule out a persistent cough. One other way to know if you have a postnasal drip is if you need to frequently clear your throat and you get up with some congestion in your throat on a regular basis. This could be an example of postnasal drip. Now, these are some of the common causes for a persistent cough. If these have been ruled out, then you will have to look deeper for some of the rarer and more dangerous causes. Some of them are lung cancer, environmental air pollutants, a lung abscess, bronchiectasis, heart failure. These conditions will have to be ruled out by your physician, who will probably ask you to do some blood tests, an X-ray of the chest, a CT scan of the chest, lung function test or spirometry, and last but not the least, testing you for your sputum. A combination of this will, in most cases, come back and give you a confirmation as to what is the reason for your persistent cough. So while cough is a very common symptom, don't ignore it if it persists for more than 2 to 3 weeks. There could be something more severe, more difficult, an underlying condition that needs to be addressed.